All right, so looks like we've got a pretty hefty stack of articles here, all about inner knee pain.
Yeah.
You've been setting a lot over.
Yeah.
Clearly, you're doing your research and want to figure out what causes it, how to find some relief,
Mm.
and how to keep it from coming back.
Yeah, and it's great that you are being so proactive about it.
Yeah.
Inner knee pain, it's really common.
Yeah.
But the good news is there's actually a lot you can do to help yourself.
Okay, well, that's encouraging. So where does this pain even come from? What's going on that inside part of the knee?
So we call that the medial side.
Okay.
The inside of the knee is it's kind of a busy intersection for a lot of different structures in there. You've got the medial collateral ligament, that's the MCL, the medial meniscus,
Mm-hmm.
and a group of tendons called the pes anserine. And any of those things can be sources of pain.
Okay. Now, I remember reading about the meniscus being like a shock absorber in the knee. Is that why knee pain is so common in runners, from all that pounding on the pavement?
Yeah, that's a great connection. So think of the meniscus like a cushion between your thigh bone, the femur, and then your shin bone, the tibia.
Okay.
And runners, yeah, they do tend to have issues there,
Right.
but it's not always just from impact.
Okay.
The meniscus can also tear from twisting motions. And actually, since you mentioned you're a runner, we should keep an eye out for any info on pes anserine bursitis.
Okay.
That's inflammation of the little fluid-filled sacs that kind of cushion those tendons,
Okay.
and that can be really common in runners.
Interesting. So it's not just wear and tear, but it's
Yeah.
also about how we move that can,
Yeah,
cause problems.
exactly.
Okay. So speaking of causes, I mean, these articles list a whole bunch of them. Arthritis, muscle imbalances. I mean,
Yeah, it can be overwhelming.
where do we even start unpacking all that?
So, maybe we could start by focusing on the most likely culprits, especially since we know a little bit about you already.
Okay, yeah.
Overuse injuries are a big one, especially in athletes. But even everyday activities, like walking upstairs or carrying heavy grocery bags,
Mm.
those things can stress the knee if you're not careful.
So it's not just elite athletes who need to worry about this.
No, not at all. I mean, these articles, they actually highlight that even weekend warriors, or people who have physically demanding jobs can experience overuse injuries.
Got it.
And then, of course, there's arthritis. Two main types often come up: osteoarthritis, which is like the wear and tear kind, and then rheumatoid arthritis, which is an autoimmune condition. That's where your body actually attacks its own joints.
So osteoarthritis is like a creaky door hinge, and rheumatoid is more like an internal battle.
Yeah, that's a pretty good way to put it.
Osteo-
And both of those can cause inner knee pain,
Yeah.
but for very different reasons.
Right. Okay. The articles also mentioned ligament or meniscus damage, which I guess that's probably from like a sudden twist or impact, like
Yeah.
if you trip while running or something.
Right, yeah.
Okay, so those are like acute injuries, I guess. But what about these muscle imbalances? That keeps coming up.
Yeah.
How can like a wonky hip muscle cause knee pain?
Well, it all comes down to how our bodies are interconnected. So, for example, weak glutes
Okay.
can cause your knee to kind of collapse inward when you walk or run, and that puts extra stress on the inner knee structures, and that can lead to pain.
Okay.
And then tight hamstrings can also pull on the knee joint, and that can contribute to problems too.
So like a domino effect.
Mm-hmm.
One weak link in the chain can throw everything off.
Exactly. Yeah, the body's a very complex system, and sometimes, the source of pain isn't always right where you feel it.
Wow, that's really interesting.
Yeah.
So, but before we, get too deep into all that, let's talk about something that's really crucial. How do you know when this pain is something you can handle yourself, or if it's time to, call a doctor?
Mm-hmm.
Because sometimes I feel like self-treating can make things worse.
Yeah, definitely.
So what are like the red flags that scream doctor time?
Well, the articles are pretty clear on this one. Severe pain, especially if it comes on suddenly, that's a big one.
Okay.
Swelling is another one. Or if you can't put weight on your leg.
Got it.
Basically, if you feel like something is seriously wrong, it probably is. Don't try to tough it out.
Yeah, better safe than sorry, right?
Right.
Okay, but let's say you're dealing with pain that's, more annoying than alarming.
Mm-hmm.
The articles mention the RICE protocol
Right.
as like a first line of defense.
Yeah, RICE is a classic for a reason. It stands for rest, ice, compression, and elevation.
Okay.
And it's most effective in those first 24 to 72 hours, after an injury or when you first notice the pain.
And just to be clear, we're not talking about a bowl of rice here, right?
Yeah. No, no, not the edible kind, no.
Okay, good.
Yeah,
All
yeah.
right. So break down the rice E protocol for me. What does each letter stand for?
Okay, so rest means avoiding activities that aggravate your knee.
Right.
Ice is key for reducing inflammation.
Hmm.
Aim for like 15 to 20 minutes every 2 to 3 hours, always with a towel between the ice and your skin, though. You don't want to, put it right on there.
Right.
Compression helps control swelling. You can use an elastic bandage for that.
Hmm.
And then finally, elevation. So propping your leg up above your heart, and that helps drain excess fluid.
So rice is like a first aid kit for your knee.
Yeah, preempt.
Okay.
Yeah.
But once that initial pain and swelling subside, what then? Do you just like completely rest it
Yeah.
until it feels 100% better?
Actually, the articles emphasize that gentle movement is really important once the worst is over.
Okay.
It helps prevent stiffness and it promotes healing.
Okay.
So think like gentle range of motion exercises like bending and straightening your knee and easy stretches for your quads, hamstrings, and calves.
So it's kind of counterintuitive. Moving even when it hurts a little
Yeah.
can actually help.
Within reason, of course.
Yeah.
Listen to your body. Don't push into, sharp pain.
Yeah.
But that gentle movement keeps things lubricated and it prevents those muscles from getting too tight.
Got it. Okay, so we've covered kind of the initial steps for relief.
Mm-hmm.
But what about, preventing this pain from becoming like a chronic frenemy?
Right.
Are there lifestyle tweaks that can make a difference long term?
Absolutely. And that's where all these sources you send get really interesting. So we can definitely dive into those long-term strategies next.
Perfect. All right, well, let's take a quick break and we'll come back and talk about all that. All right, so we've talked about what to do immediately when you're dealing with inner knee pain.
Mm-hmm.
But now let's shift gears to long-term prevention.
Okay.
And I have to say, I was fascinated by these articles that talk about the mind-body connection and pain science. It's not just about mechanics, right? Like there's this whole mental aspect to dealing with pain too.
Yeah, you're absolutely right. One of the articles explains it this way. Imagine chronic pain as like a feedback loop.
Okay.
So the pain signals make you tense up, maybe guard your movements, maybe even get anxious about activity.
Yeah.
And all that can actually make the pain worse.
So it's like not just fixing the physical problem,
Yeah.
but also rewiring our brain's response to pain.
Exactly. Yeah. And that's where the whole idea of pain science comes in.
Okay.
Some of these sources talk about how chronic pain can actually change the way your nervous system processes signals. It's like the volume gets turned up so even minor things start to feel painful.
That actually makes me think about something you mentioned earlier about how weak glutes can cause the knee to collapse inward and lead to pain.
Mm-hmm.
So it's not just about the knee itself,
Right.
but how our whole body moves
Yes.
and how our brain interprets those movements.
Yeah, exactly. Yeah, it's this really fascinating interplay between the biomechanics, the nervous system, and then even our thoughts and emotions.
Wow. Okay, so one of the articles actually used a really good analogy. They talked about a smoke detector,
Okay.
how it sometimes goes off when there's no real fire, just a little bit of steam.
Right.
So chronic pain can be like that, huh?
Yeah, like the alarm system is a bit too sensitive.
That's a great analogy. Okay, so how do we like reset that smoke detector, so to speak? What are some practical ways to address that mind-body connection?
Well, the sources offer some good insights there. One technique they highlight is called graded exposure therapy.
Okay.
So it's about gradually increasing your activity levels, starting with really gentle movements and slowly working your way up.
Got it.
The idea is to kind of teach your body that movement is safe and doesn't have to trigger pain.
So it's like gently nudging that smoke detector back into balance.
Exactly, yeah.
Okay. Are there other techniques that these articles mention?
Absolutely. They talk about mindfulness practices like deep breathing and meditation. Those can help you become more aware of your body's sensations without getting overwhelmed by the pain.
Okay.
And there's also cognitive behavioral therapy, CBT, which focuses on how your thoughts and beliefs influence your pain experience.
Okay.
It's about kind of reframing those negative thoughts and developing coping mechanisms.
It's really empowering to realize that we have tools to manage pain,
Yeah.
not just physically, but also mentally and emotionally.
Yeah, absolutely.
Okay, well, let's zoom back in on some practical lifestyle tweaks for knee pain,
All right.
especially since, you're an avid runner.
Mm-hmm.
What do those articles say about footwear?
They're pretty adamant about the importance of supportive shoes,
Okay.
not just for running,
Yeah.
but for everyday activities too. You want good arch support, cushioning, stability. You're basically treating your feet like the foundation they are.
That's a great point.
Yeah. And actually, since you're a runner, I'm curious if those articles mention any specific brands or features to look for in running shoes.
They do.
Oh, okay.
Yeah, they mention brands like Brooks, Asics, and New Balance
Oh, okay.
as good options for stability and support. And they highlight the importance of getting fitted for shoes at a running specialty store.
Mm-hmm.
The experts there, they can analyze your gait, recommend the right type of shoe for, your foot type and running style.
Yeah, that's a great point. It's definitely not a one-size-fits-all situation.
Right.
And speaking of personalized approaches, these articles also stress the importance of weight management for knee health. Even a small amount of weight loss can significantly reduce the load on your joints.
So it's not about being super skinny,
No.
but about finding a healthy weight that your body can handle comfortably.
Exactly, yeah. And they even have some practical tips for incorporating weight management strategies into your life. Like swapping sugary drinks for water, making sure half your plate is filled with veggies, and finding activities that you genuinely enjoy so you're more likely to stick with them.
Right. It's all about those sustainable changes.
Mm-hmm.
Now, these articles also mention ergonomics, especially for, desk jockeys like me.
Right.
How can our desk setup impact our knee health?
So they emphasize that prolonged sitting, especially with poor posture, can tighten your hip flexors and hamstrings, which then pull on your knees and cause pain.
Oh, wow.
Yeah. They recommend adjusting your chair height so your knees are bent at a 90-degree angle, using a footrest if needed,
Okay.
and taking frequent breaks to stand up, stretch, walk around.
So it's not about like sitting perfectly still for hours on end.
No, not at all. Movement is your friend.
Okay.
And those mini breaks can be super helpful for both your physical and mental well-being.
Yeah. One thing I'm curious about, do the articles mention anything about assistive devices like knee braces or compression sleeves?
They do. They suggest that those can be helpful for providing extra support and stability during activity, especially if you have a ligament injury or are recovering from surgery.
Okay.
But they caution against becoming reliant on braces long term,
Oh, okay.
because that can weaken the muscles around your knee. It's about finding a balance, using them strategically for support while also working on strengthening those muscles.
So it's about empowering your body's own support system, not
Mhm.
just relying on external aids?
Exactly.
Okay. Well, and speaking of empowering the body, let's talk about targeted exercises for inner knee pain.
All right.
Because these articles list a whole bunch of stretches and strengthening exercises. But since you're a runner, I'm sure you're familiar with some of the basics.
Right.
I'm curious which ones these articles highlight as being particularly helpful for inner knee pain.
One they emphasize is the adductor stretch, which targets the muscles on the inside of your thigh.
Yeah.
Those tight adductors can pull on the knee and contribute to pain, so stretching them regularly is crucial.
Mm-hmm.
And they also mention hip flexor stretches because tight hip flexors can also contribute to knee problems.
And just to be clear, we're not talking about stretching into pain, right?
No, right, exactly. It should be a gentle, comfortable stretch held for 20 to 30 seconds.
Okay.
And then on the strengthening side, they highlight the importance of exercises that target the glutes, the hamstrings, and the quads.
Mm-hmm.
Having strong muscles around the hip and thigh, that helps to stabilize the knee and prevent it from collapsing inward, which can reduce stress on the inner knee structures.
Got it.
So some examples they mention are squats, lunges, bridges, hamstring curls.
Now, I imagine proper form is really crucial for all those exercises.
Absolutely. Yeah, they recommend working with a physical therapist or a certified trainer initially to learn the correct form and make sure you're activating the right muscles. And then once you've mastered the technique, you can incorporate these exercises into your regular workout routine.
So it's an investment in your long-term knee health.
Yeah, exactly.
Okay. Now, these articles also mention foam rolling as a technique for releasing muscle tension and improving mobility.
Right.
Do they suggest any specific areas to focus on for inner knee pain?
One they emphasize is the inner thigh, rolling along the adductor muscles.
Okay.
That can help alleviate tightness, improve flexibility, which can reduce stress on the knee.
Right.
They also suggest rolling the IT band, which runs along the outside of your thigh.
Oh, interesting.
Even though the pain is on the inside, it seems kind of counterintuitive.
Yeah.
But that IT band can get really tight and pull on the knee.
Oh, wow.
So releasing that tension can help improve your overall leg mechanics.
It's all about that interconnectedness again.
Yes.
Okay, well, we've covered a lot of ground here. We've talked about, pain science, lifestyle tweaks, targeted exercises.
Hmm.
But I want to shift our focus now to those other therapies that are mentioned in these articles, things like acupuncture, massage therapy, and even nutritional support.
Okay, yeah, that's a great transition. Yeah, we can definitely delve into those alternative approaches next.
We've covered a ton of ground on inner knee pain, the
Hmm.
causes, the symptoms, different treatment options, both conventional and alternative.
Hmm.
But I always find that hearing real life stories makes all this information so much more relatable.
Yeah.
And actually, your stack of articles included a couple of really inspiring examples.
Yeah, those personal stories are so powerful. One that really caught my eye was about a yoga instructor who she developed inner knee pain that started interfering with her practice.
Yeah.
It turned out to be sensory bursitis, which we talked about earlier, that inflammation of the tendons on the inside of the knee.
Oh, I remember that story. Yeah. She mentioned that even simple poses like Warrior Two and Triangle Pose
Mhm.
became painful for her. So how did she end up managing to get back to teaching?
She she took kind of a multi-pronged approach.
Okay.
So first, she modified her practice. She avoided poses that aggravated her knee and focused on strengthening her hip and core muscles, which helped to stabilize her knee joint.
Okay.
She also incorporated regular stretching, particularly targeting her hamstrings and inner thigh muscles, which can get tight and pull on the knee.
Hmm.
And she found that foam rolling those areas really helped to release tension and improve mobility.
So it was a combination of adapting, strengthening, and addressing those muscle imbalances we talked about.
Exactly. Yeah, and she also she started using kinesiology tape,
Okay.
which is that colorful tape you sometimes see athletes wearing.
Right.
It's thought to help support the muscles and reduce inflammation.
Okay.
And she found that taping her knee before teaching provided extra support and it allowed her to move more comfortably.
It's amazing how creative we can be in finding solutions that work for our individual needs.
Yeah.
The other story that really stuck with me was about a gardener who developed osteoarthritis in his knee.
Right.
I I can imagine that's a tough diagnosis for someone who's so active and loves working outdoors.
Absolutely. And his story really resonated with me because it highlights the importance of adapting and finding joy in movement even when limitations arise. So he had to modify his gardening techniques. He started using tools with longer handles so he could avoid kneeling and squatting as much.
Right.
And he also started taking more breaks throughout the day
Right.
and incorporating low impact exercises like swimming and walking into his routine.
So finding ways to stay active without overstressing those joints.
Yeah, exactly.
Did he mention any alternative therapies that he found helpful?
Yes, he tried acupuncture and found that it helped to reduce his pain and stiffness. And he also worked with a massage therapist who specialized in myofascial release. It's a technique that focuses on releasing tension in the connective tissues surrounding the muscles.
I love how these stories showcase the diversity of approaches that people find helpful.
Mhm.
It's not about finding a one-size-fits-all solution, but rather like a personalized approach that addresses your unique needs and preferences.
Right. And speaking of personalized approaches, I'm curious to hear what those experts you mentioned, what they had to say.
Well, one of the physical therapists in your articles really emphasized that it's not just about treating the symptoms,
Right.
but about identifying and addressing the root cause of the pain.
Hmm.
They actually said we need to look at the whole body, not just the knee. Often knee pain is a symptom of dysfunction elsewhere, like weakness in the hips or tightness in the ankles.
Again, it's that interconnectedness that we keep coming back to.
Yeah, exactly.
So a good physical therapist will take a holistic approach.
Assessing your movement patterns and identifying any imbalances that could be contributing to the knee pain.
Exactly. And the orthopedic surgeon in the articles also echoed that sentiment. He He said, technology has advanced tremendously in recent years, and we have amazing tools for diagnosing and treating knee problems.
Yeah.
But the most important tool is still a thorough clinical exam and a good conversation with the patient to understand their goals and expectations.
There's not just about those fancy scans and high-tech procedures,
Right.
but also about that human connection and personalized care.
Yeah,
Uh,
absolutely. And both physical therapist and the surgeon emphasize the importance of patient education and empowerment.
okay.
They believe that the more you understand about your body and your condition,
Yeah.
the better equipped you are to make informed decisions about your treatment
Mhm.
and participate actively in your recovery.
I love that. It's about being an active participant in your own healing journey,
Yeah.
not just a passive recipient of care. Okay, well, we've heard from real people. We've gleaned insights from experts. We've explored a wide range of treatment options. But I'd love to kind of wrap up this deep dive with some practical takeaways for our listeners. What are some key things people can do in their daily lives to manage knee pain and prevent it from, you know, sidelining them?
So, first and foremost, listen to your body.
Okay.
Don't ignore pain,
Yeah.
but also don't be afraid to move.
hmm
Gentle movement is often your best friend.
So finding that sweet spot between rest and activity.
Exactly. Yeah. And prioritize those small, consistent habits that support knee health.
Hmm.
Choosing supportive shoes, maintaining a healthy weight, staying hydrated, and incorporating regular stretching and strengthening exercises into your routine.
You know, those little things really do add up over time.
They do. They
Yeah.
really, really do. And remember, it's a journey, not a race.
Good.
Be patient with yourself, celebrate your progress, and don't hesitate to seek help from, qualified professionals when you need it.
That's that's such an empowering message. We've
Yeah.
covered so much ground in this deep dive into inner knee pain,
Yeah.
and I hope our listeners feel informed, inspired, and ready to take charge of their knee health.
It's been a pleasure exploring this topic with you. And remember, knowledge is power. The more you know about your body and the resources that are available to you,
Yeah,
the better equipped you are to navigate the challenges of knee pain and live a full and active life.
absolutely. So to our listeners, thank you for joining us on this deep dive into inner knee pain. We hope you found it informative, empowering, and maybe even a little bit fun.
Yeah.
Until next time, keep learning, keep moving, and keep exploring the fascinating world of health and wellness.